repeal Obamacare. Our next guest is a lawmaker and cancer survivor who voted against the House's resolution on that matter and says it's time to stop the politics and fix our broken system. Texas Congressman Chip Roy joins us. Congressman, so a Texas court's looking at the constitutionality of Obamacare. That's what brought this up again. And it looks as though they might say it's unconstitutional. Do you want that as a Republican?
Well, Brian, thanks for having me on this morning. I really appreciate it. Absolutely, I think it's right that the state of Texas, led by Attorney General Ken Paxton, is leading 20 states, along with the Texas Public Policy Foundation. And they've gone into federal court and they won because Obamacare is problematic and is constitutionally unsound. And I think they're going to have a good case in the Fifth Circuit and the Supreme Court. And Republicans shouldn't be afraid of that. The president is right to stand with the states. He's right for the United States not to defend Obamacare's constitutionality because it's not constitutional. And I think Republicans shouldn't be afraid of it. We have the solutions that the American people want. We want prices of health care to go down. We want health care for all Americans. We want health care for all. Instead of these false promises by Democrats like Medicare for all, which would cost $30 trillion, Bernie Sanders is out on the campaign trail every day criticizing the current broken health care system. And he's right that it's broken, but it's broken because of government intervention. It's broken because costs are going up and people can't get access to insurance or health care. And his solution is a $32 trillion Medicare for all solution. The president is giving Republicans a second chance to do what they promised to do and repeal Obamacare. The president is leading. We need Congress to now get in the game and stand up for health care for all Americans instead of this broken system we have today.
Listen, I sat here at this very place, talked to different lawmakers along the way and experts, and we know you couldn't keep your plan if you want to keep your plan. We know we didn't keep your doctor if you want to keep your doctor. We know the deductibles are too high, but now it looks like most studies show over 50% of the American people want Obamacare to stay because they maybe in some cases they don't know what will replace it. Taking something away from somebody is a lot different from when you passed it. So how do you plan to overcome that?
Well, I think if you talk to people, I tell you, people in Texas, they're still very frustrated with Obamacare in terms of what it's doing in terms of cost, lack of ability to get the doctor of their choice, the regulations that are making it difficult for their families. So our solution is simple. We want to make sure we have direct primary care so you go to doctors. We want to make sure you have health savings accounts. We want to have portable insurance that you don't lose when you go job to job. We want to have health sharing organizations that defray the costs. And by doing all of that, we can guarantee that people will have health care and we can protect people with pre-existing conditions through things like high-risk pools. And if we do that, we'll get the cost of health care down, and everybody in America can have health care. The false notion of pre-existing conditions is that we're mandating people get insurance coverage through Obamacare that's broken and unaffordable. That's the problem. So Republicans just need to stand up and talk about the things that the American people want, which is affordable, high-quality health care.
I know, but you know nothing's going to get done before 2020. The president's admitted that. For you personally, this hits home because you dealt with cancer. What did you see in that system as you battled for your life that made you so adamant to change things?
Well, I'm glad you asked that. I am a cancer survivor. I had Hodgkin's lymphoma. I had a 4-month-old daughter. I had a barely 2-year-old son. And I was blessed to be able to go to MD Anderson and get care from a great doctor down there. But what I saw was how important it was for people to be able to get access to health care, be able to go to the doctor of their choice. And importantly, it gave me a commitment to want to get back into public service to make sure all Americans can have health care. We've got to get out of this broken notion that insurance is the answer and government is the answer when you want to be able to go to the doctor and be able to pay for the services you want to get and then allow the system to be able to step into the breach when people lose their coverage. It is a very small percentage of the population, very small, who don't have coverage under Medicaid, Medicare, or under employer-provided health care or in the private market. We want to make sure we increase options, not decrease them. We want to lower prices, not increase prices. So that's the goal of what we want to do in health care.
Name 2 Democrats that will work with you.
Well, I don't know about which Democrats will work with us. I mean, there's some great folks. Henry Cuellar in Texas is a great guy to work with, and there's other people. But at the end of the day, what we can do is come together and present a vision that the American people will get behind. That's the goal. The President of the United States is doing that, and Republicans on the Hill need to follow the President.
Congressman, I understand, but the people you're dealing with want to find out what the President's bid to buy the Buffalo Bills consisted of. They're not looking to solve big problems because it might make the President look good when it should just make the American people feel better. Congressman Chip Roy, appreciate your passion. Glad you're okay.